throughout the next couple hours, we'll be describing strategies of conducting research, so sort of the how. We'll list literature that provides evidence for treatment modalities. We'll identify the differences between an empirical peer-reviewed resource versus popular press. And we'll describe the process of identifying and analyzing and applying quality research, so the critiquing part of evidence-based practice. And we'll explore and discuss the most effective and evidence-based strategies to treat mental health disorders in children. So we'll bring up different mental health and just how to find the evidence-based research to support practice. And we'll put all that to practice by providing a clinical case study. We'll evaluate societal and cultural factors that may influence evidence-based practices used to treat mental health disorders in children. And then we will analyze ethical issues arising when using evidence-based practices. And we'll examine approaches used to discussing evidence-based practices with parents of children with mental health disorders. So this is a model that I love. When I first started learning about evidence-based practice, I was frustrated a lot because I couldn't find research that would support, or the research articles that would support different interventions didn't work with my particular clinical practice, or parents would say, I don't want to do that. And so I think, how can I be an evidence-based practice clinician when all these challenges would come up? And luckily, a lot of people were feeling the same. And so there's been a lot of work over the last 20 years to really define better what evidence-based practice is. So the first step is just being able to interpret research findings and applying those findings to a clinical practice. But that's not all of it. It really requires clinical decision-making. And that clinical decision-making is based on the clinician's experience and also the patient's or the parent's preferences. And all that comes together to form evidence-based practice. It's also a process of realizing when a certain practice is outdated, even though there might have been evidence in the past that says this looks really promising and it shows positive outcomes. We keep learning and we keep having better and better tools and interventions. And so some of those evidence-based practices of the past just aren't appropriate anymore. So making sure that all of us continually learn. And then applying the evidence-based practice, considering all the unique needs. And so you'll notice as we talk about different research, some of it is limited by demographics, the age of the child, the gender of the child, the geographic area. And so you have to really consider, does that apply to who I'm seeing right in front of me? So not forgetting all those unique qualities in any individual child or individual family.
Whereby drives your clinical endeavors.
Yeah. Yeah, so this is just a slide to go into a little bit more of the history of evidence-based practice. So really, mental health in children didn't reach a level that was even researched at all until the early 20th century. So mental health in children has been way behind some other physical conditions or even mental health in adults. And then there was this, we can't treat children the same as adults with similar symptoms, yet in decades gone by, that's exactly what they tried to do. And that was found to be pretty dangerous. So we can't use the same evidence that we see with adults on children. So the first textbook on childhood mental disorders was published in 1935. I encourage all of you to look at that. It's pretty hilarious now of what we thought then versus what we know now. And then there was this big gap. So research didn't really start to increase until the 1980s because a lot of researchers were afraid to research children. It took extra review boards to really think about, is this safe to research children? It takes parental consent, all sorts of ethical issues came into the world of research. And so it took many decades to have researchers feel comfortable again.